Here's Guy Wayman, Ben Brunson, and Frank Vernuccio inside the news.
All right, welcome back to Inside the News. Glad to have you with us. And Ben Brunson's here and Frank Vernuccio. Hi, Frank.
Great being with you both.
Ben?
Good afternoon, gentlemen. It is a pleasure to be with you.
All right, this is one of the segments where we kind of pick up on some of the pieces that we have to kind of marriage this thing together. And Frank, we've got a Congress and we've got a people and even the media that are unwilling to face the tough issues and willing to address the problems.
Yeah, the nation needs to start distinguishing between the issues that count and those, frankly, that are, well, to be blunt, nonsense. The fact of the matter is, whether we're talking about our underfunded and depleted national defense, whether we're talking about Social Security, Medicare going bankrupt in the next 20 to 30 years, whether we're talking about the collapse of our healthcare system thanks to the ravages of Obamacare, whether we're talking about the fact that our middle class is devastated thanks to 8 years of horrible policies that have destroyed jobs. These are the issues that count, but we're not seeing a real concentration on these issues in Congress or in the media. We have to start putting aside, quite bluntly, and I know this will enrage a number of people, nonsense issues. Talking about transgender access to bathrooms is not an important issue. Whether the United States can survive in a hostile world environment, whether we're going to preserve Social Security and Medicare, whether we're going to get our middle class out of the horrible plight that has suffered over the past 8 years, those are the issues that count. And let's throw in one more there as well. Our public school system is collapsing in this country. Our students are nowhere near competitive with their peers around the world, and what they are being taught, frankly, is a lot of left-wing propaganda nonsense. Those are issues we need to take an immediate look at, and we have to start putting a lot of the nonsense issues aside.
You know, that goes with what we were talking about in our other segment when we were talking about the Poland speech here, Ben, is that the left could not get on board with true American values, and the left wants to deal with these other peripheral fluff issues instead of getting down to the meat of the matter, Ben.
Well, that's very true. We face serious issues in this country. They are long-term. They are systemic. The fact is that over 80% of our budget and growing is entitlement programs, is to fund entitlement programs. Medicare, Medicaid, Social Security are the two most famous, but we have a growing entitlement program and Obamacare and another growing entitlement program that's not talked about virtually ever, which is federal employee retirement spending, which is becoming an ever-growing chunk of our, I think it's $270 billion and growing at about 8% a year right now. So these are huge issues. The last time we did any meaningful reform to any entitlement program was the Social Security tweaks that helped maintain extend solvency for 2 to 3 decades. That was done by Ronald Reagan, and it was done because he had a Democratic accomplice in Tip O'Neill, and they were willing to, despite their sometimes personal animosity, willing to put that aside to address Social Security and help to make it solvent. But the issues haven't changed. All they did was push the day of reckoning out into the future. No one talks about these issues. Look at the difficulty in a relatively new, only a 7-year-old entitlement in the form of Obamacare. The issue I always had with Obamacare was that it was a new entitlement program. And look at the difficulty we are facing in trying to adjust that. What's going to happen if something does happen, it's increasingly apparent that it won't be a repealing of Obamacare. It will be a tweaking of Obamacare to extend the life of this entitlement. But every time we do this, it's like the states who promise great pension funds and then don't pay for it. All we're doing is pushing the day of reckoning out into the future, and eventually the future arrives.
You know, Frank, Ben hit on something here that Reagan had Tip O'Neill in his back pocket. Mitch McConnell, he was just saying, well, we need our Democratic partners to come on board. Schumer says, hey, we're willing to do it. And they would actually get on board, but it would be a huge huge entitlement because that 1/6 of the economy of health care would turn into a single-payer system.
Yeah, what we're not talking about, of course, is that Obamacare coverage for most Americans is an illusion. You pay outrageous premiums, and then you wind up having deductibles that are so large as to make the coverage, unless you have a truly catastrophic illness, almost a total illusion. We're talking about $4,000 to $7,000 in deductibles after paying a massive amount of premiums that continue to grow larger and larger. We talk a lot about what happens if Obamacare is repealed. We're not talking about what happens if Obamacare is not repealed. For so many Americans, the cost of health insurance has shot up dramatically, in some estimates 25% at least. And yet the coverage that you get under Obamacare really isn't there at all, unless you hit $4,000 to $7,000 deductible marks. Not to mention the harm that Obamacare has done, and let's go back to our discussion of the middle class, what it's done to middle-class jobs. Obamacare absolutely rewards eliminating full-time positions and replacing them with part-time positions, striking at the very heart of what makes the middle class, decent full-time jobs. So we should be concentrating on what would happen if Obamacare is not repealed and how that will continue to devastate the economy without providing any increase in medical care, actual medical care for the American people. It's an illusion.
Yeah, Ben, in just about 30 seconds, just kind of, you want to put a button on that?
Look, absolutely. Obamacare was an attempt to shift the cost of about 5% of our population under 65 that is chronically ill and very expensive to cover. They received coverage historically. It was usually written off by hospitals, and that cost was essentially on the corporate insurance market. We decided to shift that cost in return for giving them actual insurance coverage. We shifted that cost theoretically to young people who are going to be mandated to pay for insurance and therefore underwrite the cost of this chronic care. The young people haven't come on board the system. The mandate is probably going to go away, and the penalties have been far less than the cost of insurance. So young people haven't brought on board, and the whole theory has failed, which seemed to be the intention of Obamacare from the get-go. It was, I think, really just a way station to get to a single-payer system.
All right, we're going to be back with our hot button topics, and to wrap things up, we'll be back.
You're listening to Wayman, Brunson, and Vernuccio, Inside the News.